there's like an approver that has to approve it before us, but it shouldn't be more than 24 hours.
And the website again, please?
Let me just...
give everybody a chance. vimeo.com/showcase. CASE/ Now, do you have to put all the numbers in also?
You do.
7585346 and a question mark?
A question mark.
And then
Page
2.
Equals 2. Yeah.
Equals 2.
page equal to.
And no spaces in all of this, correct?
No spaces. No spaces.
Okay, great. Thank you very much.
You're
Thank
very
you.
welcome.
I had a question. Is there any way that the Parks Department would be interested, now that we're talking about this technology for seniors, doing a class for technology for seniors? Like,
Yeah, we can look into it. Absolutely.
I think, like, I mean, I'm sure y'all do it like for camps for kids, right?
Yeah, we have a code. I mean, it's coding, but we can do something a lot more basic. Yeah, we can definitely look into that.
I think that would be amazing, because we, as performers, there's so much they can be listening to and so many ways that they can entertain themselves. If you need somebody to help you with that, I can do that. I can volunteer to do that.
Yeah, I can look into that. We can maybe do a little tutorial that it would just be getting them there, since it's a tutorial on how to. It would be kind of difficult,
Right.
because it's like on how do they get there if they don't know how to do it, but it's a tutorial on how to get them there. So maybe if you guys help them, but we can do a tutorial they can always access. Maybe they can have it as like a smart link or something.
Yeah.
And like they can see the actual screen, and like, I think I'm a visual person, so I need to like.
Yeah, me too.
Yeah.
Yeah, we can put. We'll talk to the team and see what we can put together.
I would like to. I have some questions, please. But
Okay.
first, I have some reflection, and I record my reflection. I hope you hear well.
As we know, when we are living in a health crisis due to the coronavirus pandemic, there are many people who, due to, among other factors, boredom and the loss of freedom due to confinement, added to social isolation, are experiencing worry, anxiety, fear, uncertainty, hopelessness, and stress, decreasing their ability to increase their immune system and therefore be more susceptible to contracting the coronavirus. Classes by Zoom have many limitations. No one corrects you. It is an experience of loneliness, is you and the screen. I believe that activities that help to break this sad routine and give a light of hope to adults should be supported. Obviously, with all the required masking and distancing precautions, what is the possibility of subsidizing and providing teachers of Tai Chi, yoga, chair, stretching to the buildings of seniors? We at Stella Maris have a large outdoor space and we can provide chairs for these activities.
Well, I think so. It's time to cut. We have two options. By Zoom, the people can move easy, but there are people who can't move to go outside, and it's a very, very stressful for the people stay in their home and to see the screen. They feel lonely. We have to thinking about what kind of what possibility to send teachers to the building. In my case, I in Stella Maris, we have a big space outside, and we would like to have some teacher of Tai Chi, stretching, or dance, or whatever is possible. It's my question for Lucy Alonso, please.
So at this time, we are doing phases to start. We just started with our children. We have an after-school program, and the kids are coming now. So that's our focus, making sure that we can start safely and have them. So we are looking into different things that we can do for our seniors. Our virtual programming is something that we started now. We can start looking into doing classes to teach seniors on how to access that better. But at this time, we just don't think it's safe to have seniors gather. Also, a lot of the senior centers are not allowing us in. But we do plan on restarting and whatever that looks like, whether it's in our facilities or not in our facilities, we are open to looking at different ways, and we hope to start that soon. So hopefully maybe in November, the numbers stay down. But
it's many months. We wait and wait and wait. And this pandemic going to be for months, maybe, I don't know. I hope so, no, but whatever, the people are stressful. The people need to get out. I don't want to take a bus, go to some park or some place to take a class. I would like to take very safe outside of my building. It will be possible. And then there are a unit is have a big building, very safe. I don't know why don't there are in class there. I don't understand.
Well, our goal is to start and hopefully sooner than later. But a lot of the senior centers are not allowing anybody to go in. If that's what I've been told.
But the recommendation is to keep the mask and to have the distance. The people go to the supermarket, big shopping, and they're more closer, more unsafe. If we take classes, some exercise, we keep it more safe. But it's no reason. If you keep the precautions, you be safe.
So maybe Magnolia can assist me, but I from my understanding is that they're not promoting senior gatherings of any kind at the senior centers. Magnolia, is that correct?
Yes, it is correct. Here at Rebecca Towers, we are not holding any activities, no congregation yet. No, not yet.
So that is one of the challenges that we have in doing so, going to the senior centers. Our main priority is for everybody to stay safe and to get through this. So we do, as much as we do want to start programming and we know how important it is, we also want everybody to just be safe and we want to adhere to those guidelines.
But I think the fact that right now you have what you share is a really good source because that gives them the opportunity. As opposed before they didn't have that. The window for them to be active if it's in their apartment, but it's with an instructor. It's a guided, class. And I didn't have that before. I'm going to be sharing this with my residents.
Yes, I will share the flyer, and if you would like, we can have somebody go and take you physical flyers by the end of this week.
Excellent. Thank you.
Gabby, you have a very good point. They're out, they're shopping, and they're doing other things. Have you talked to the administrator of your building about this? Would they allow?
Yes, I talked to the administration and said we allow outside to have classes is allowed. They say yes.
That's good.
Only we need a teacher. We need support.
Well, if everybody can start talking to your administrators and get some rules and regulations, I'm sure that your building, Stella Maris, would have some guidelines. And if someone wants to put it in writing, then we certainly can take a look at it and try and get some contact and work on it.
Thank you, Debbie.
Okay. Send that to Diana, and then she can tell us what we need to do. Okay?
Okay, for freedoms and council towers are not allowed. No,
Okay, we can check those off right now.
No, Federation too.
they are not
Because
allowed.
it's in remodel. Mhm.
So we know for sure, Four Freedoms is a no,
No, and council towers.
North and South is a no, and did I hear Federation say same
Mhm.
thing?
No, same thing, because it's in
Federation is no.
remodeling, yeah. Mhm.
So we don't know about Rebecca Towers, and there's a potential at Stella Maris, correct?
Rebecca Towers is a no.
Okay,
Debbie, the seniors flamenco group is doing their class outdoors in Flamingo Park, but the weather
Yeah.
is not conducting into meetings. I would like to know is it's possible to use the city hall parking lot on the third floor where they usually do exercise. Is possible?
Diana?
I can ask, what floor did you say? Like the same floor, the sixth floor?
The sixth floor. And then either it will, I don't know who is the contact in unit to allow some teachers do exercise, do classes for the exercise, because this local is amazing. It's amazing, but nobody there, no food, nothing. And then when I pass by, I say, "Oh my God, this is so unbelievable." There are the ceiling is very high. The stairs is very easy to for the people to go up. Okay, the people with the chair don't go, but there are many people who can walk and can do it. Yeah, and don't have any place to go to be safe. Please, I don't know who is the answer unit who could answer me this question. Allowed to do classes there? I don't know. Debbie, can you answer somebody? I don't know.
No, I can answer that. I know that, I mean, even the exercises for the city employees have not continued. So I really don't think that they're going to allow for the flamingo class. But I can ask. But even
class, no, only flamingo class flamingo in the city. But I say in the unit, in the local of the unity, or in the.
Are you talking about Unidad?
The both. I say, okay, you're going to see about the parking lot, right? But now I'm talking about the unit in the Unidad, in Unidad. It will be possible to the teachers can be there and give class for the people? It's possible?
Okay, no, I'll reach out to Unidad and I'll reach out to the city about the city parking. Okay?
Yes, and another question. In the city, there are some office about to work about the activities for seniors, specific for seniors. There are some office. I don't know.
What's the question?
Yeah, my question is, in the city where you work, Diana, there are some office who take care about seniors activities.
Well, that's what we had the presentation last week. Maybe you missed that part, but we did have somebody from the community services give an update on what they provide seniors in their department. But I can get you the contact, and I think she also sent a flyer. I'll resend that flyer that has what they do for the seniors.
Okay. Okay.
We had Gloria on the line. You know, she works in the mayor's office, Gloria Campos, but I don't see her anymore. I wanted her to also give an update of what she does, but I'm gonna try to get her back on the line because she's texting me. But I'll send you that information as far as what seniors, what the community service department does for seniors.
Yeah. Okay. It's very interesting to know now. There are classes in North Shore Park. This is interesting. I never know that. I don't know how long they do that. Start. I don't know. But it's another option for the people. Many options is better
Good.
than nothing. Okay, thank you.
All right, so at 10:30, we have our guest speaker, Dr. Clifford Medina. He's the Chief of General Medicine at Mount Sinai, and he's going to be presenting on the importance of the flu shot. So before Dr. Medina arrives, we're going to go through the rest of each senior citizen center and ask if you, for a little bit of an update. Council Towers, north, south. We have an update on what's going on.
I think our liaison hasn't finished her paperwork, so we'll have to go straight.
Okay. Four Freedoms?
Yeah.
Inilda?
Yeah. No, everything is all right here. Okay, we're through renovation of the building, but everything is all right.
They're still going on with the renovations?
Yes, this will take a long.
Okay, all right.
How long will the renovations last?
Oh. Until next year.
Next year?
And same to, well, I'm not representing Council Towers, but since I work there, we are going through a renovation too, and this will take more or less 2 years.
Okay,
Okay.
All right.
okay.
Hi, everyone. It's Oscar.
Hi, Oscar.
Hi, Debbie. Congratulations.
Thank you.
I apologize for being on the call late. So some of you might know I had a little bit of a hectic morning. But everything's fine. We're all good. Dr. Medina is going to be on shortly. He has a residency training program, and he's going to be on. But I have a couple of questions, especially for the senior living facilities, Magnolia and Anilda, and the rest of you. What's going on with open enrollment? You know, this is the open enrollment period with all the insurances. Are the seniors being helped? Are they getting all the information that they need? And so forth.
Well, here at Rebecca Towers, as always, we haven't stopped. Ever since the pandemic started, we've been present. So any questions that residents have, if they want to change, our doors are open. Many times we don't do one-to-one, face-to-face, but we have been using our phones and using a lot of conference calls.
Okay.
Where we our resident, then we put them in contact with whichever insurance they want to either change or even question. So
Okay.
that's what our office has been handling the questions or their needs in reference to changing health insurances. Many of them are not changing; they're staying with the one that they have.
Okay.
But if to change or want to change or they want more information, the conference call system has been really helpful for us because it has helped us keep the social distance, but at the same time help them. So
Okay.
that's what it has been here in Rebecca Towers.
Okay. All right. That's great. So, like every year, we at Mount Sinai, we're agnostic to all insurance companies and everything, but we want to make sure we vet the insurance agents that that we sort of associate ourselves with to make sure that they're giving everybody the correct information, because I know that during open enrollment, it's like a free-for-all of all of these agents. So if you have someone that has any questions regarding their insurance and they want to talk to an agent, we have agents that cover all the insurances. We work with all the insurance companies, not just one or two. We cover all, and we can refer them to that insurance agent if they have any questions.
Oh, that's good.
Okay. Thank
How
you.
would they reach out, Oscar? How do they reach out to you or to the
They can
insurance?
call me. They can call me by my cell phone. Magnolia has my cell phone. Everybody here should have my cell phone already. They can give me a call, and then what I'll do, or actually, we also have another phone number that I'll send it to Diana, and that's sort of like a call center that we have. And that person is answering the calls, and they refer the person to the insurance agent or the insurance company that they want to speak to.
Okay.
Okay. And I have the other question is more on a lighter side of here comes the holidays. What's going on for the holidays at the housing units?
Well, for here, for Rebecca Towers, we're already getting ready for our Halloween, which is the first one, and we're gonna be doing goodie distribution, which is a bag with candies to their doors.
Okay.
Everything being handling here, from donations to food distributions and goods, everything has been delivered to the resident's door. We knock, if they're there, we leave whatever the donation is. Being if it's food, we never leave those on the door because we don't want them to go spoil.
Right.
But that has really enforced social distance, but also to encourage our residents to remain in the units and no need to go out without any need, really, because many things are being donated here to Rebecca and they have been using. So we don't want them to get that for the holidays coming up. So the first lineup is the goodie bags for Halloween. We're working for our Thanksgiving meals and also the holiday season. Our residents haven't been alone here in Rebecca Towers. We've been here for them. We had modified our office hours, but there's always staff here. So our residents know that they're not by themselves. If they need us, they can just call us. So for them, I don't think the isolation, as many have been talking, hasn't really been at least I don't feel it here in Rebecca Towers because we have been accessible to our residents.
Okay.
Well, regarding Council Towers and for Freedom, well, I don't know. I have to check with the service coordinators for the buildings, but I think we are not. At least for Halloween, we decorated the building, inside the building, the area, the common areas. But I don't think we are going to have anything scheduled for the Halloween. And for Christmas and New Year, I really don't know. Thanksgiving, I don't know if they are planning anything. Okay.
For Jewish Community Services, our Meals on Wheels program did provide an additional bag to the seniors who get Meals on Wheels on the Miami Beach for the high holiday. And then they are going to do an additional food distribution with the Meals on Wheels for Thanksgiving. So we are also, with those particular events, we have volunteers that are just doing at the door delivery, not face to face.
All right. Lastly, I have one last thing. I know last time I was on, I talked about if anybody has any questions regarding Mount Sinai and the coronavirus, if they should go get a procedure, or again, you could always give them my cell phone number if any of your residents have any questions regarding, again, anything about Mount Sinai, they can call me.
Okay.
Thank you.
Oscar. When Dr. Medina comes on, if everybody will please mute your speakers and microphones so that we can give him undivided attention. For anybody who hasn't noticed, Melina posted in our chat that there are yoga classes at the North Beach Band Shell. So Gabby, you might want to look into that and see.
What days, what hours? When?
Melina, do you know what days and hours for the yoga?
Yes. So, hold on. Yes. So I will find out. I'm not sure, but I saw that they went live, like they did a live of the yoga classes, and they have a lot of space. So it would be kind of a safe thing to go do inside. I'm going to talk to Benton. He's the head of the North Beach Fan Show, and I will let you guys know. Is that okay? Because I'm not sure what days. Let me see if I can find it. Hold on, and I'll let you guys know. Let me see if I can find it now.
It's very important.
Yeah, because it's a safe area, safe space. You know, and you can walk there or take the bus there or something, and it's safe.
Thank you, Melina.
Yeah.
Right. Before Dr. Medina comes on, we want to talk about the November 30th meeting. Our meeting is always the last Monday. Diana, I'll be out of country till late that day. So do you have a suggestion, or do we have a vice chair? What should we do about that?
Yes. I was suggesting, I do have to check with communications to make sure that there's no other meeting for when we decide.
Okay.
If we just wanted to move it to the, let me look at the following.
Wait a second. So this is our November meeting. Do we
No.
want to move it to the week before in case any of the seniors need something, any emergencies through Thanksgiving? Is there anything we need to address? If not, then the following week. Either one I'm fine with.
The 23rd?
What does everybody think? Unmute yourselves and let me know.
That is the week of Thanksgiving.
That is a
Maybe people are traveling the whole week. We don't know.
Okay, then move it to just the following week, December 7th,
Yeah, much
and
better.
do 2 meetings in December.
Better.
that is very. Mhm.
Diana, you want to check and see if that's okay?
I'll check December 7th, right? Correct?
Yeah.
Okay. I'll check with communications. It shouldn't be a problem because Mondays are usually, and I'll confirm via email.
Okay. Gabby, can you get into the chat area? Because Lucy has posted
Yes,
memo for workouts. Okay, everybody can see that. All right, good.
I took a picture.
Okay, perfect. Does anyone, let's see, Rebecca Towers we covered, Magnolia, there's nothing else you need for Rebecca Towers?
No, I don't think so. Ileana is usually the one that sits in for Rebecca Towers, but she was not able to meet. That's why I'm sitting here for her.
Perfect, okay. Before Dr. Medina gets on, is there anything else that you guys would like to bring up for the seniors? Can everyone please go back to your administrators and talk to them about Oscar and the insurance? Open enrollment, that's kind of important, so if you can talk about it this week and make sure that they're checking as they go door to door, or whoever has daily contact with the seniors, put it on a list to ask them about the insurance, to ask them if they have any questions or concerns about going to the hospital. I think it's great that we discuss it, but I think we need to be very proactive and try and get whoever has daily contact with these people to get the authority to ask these questions so that we know that when people need help, and I think they're very important questions. I think the flu shot, after Dr. Medina speaks, the information that we learn can please be taken back. This is a recorded meeting, so any admins can go back and look at the recording to get the information and discuss it with the seniors. We need to reach out and try and help as much as possible.
Okay.
Oscar, will you be telling us when Dr. Medina is available? Whoops, you're on mute.
Sorry. Yes, he's logging on right now.
Okay. Did someone else have a question?
Yes. Debbie.
Yes.
Okay. I'm concerning about the security of our building, Federation Tower. We don't have any security after hours, after the office closed. We don't have anything. And it's 11th floor. We are all seniors, and everybody is concerning because since March this year, we are in renovation. So it's a lot of people in and out, and a lot of different trucks and, different cars, and also in the weekends. And all of the tenants, my neighbors are concerning about that. And any suggestion to get like Rebecca Towers have like a Council Tower, everyone that have 24-hour, that security over there to help us, to security us. Any way to do it?
Diana?
Magnolia, is that like a private security company or is that with the city?
No, it's private. It's private. Yes.
Yeah.
Oh, so the building has to pay it, right?
Yes, we pay for it.
I mean, I can still ask. I'll ask police department, to maybe keep a watchful eye, just because during construction right now.
Okay.
I think it would be nice, Diana, when you're talking to the police department, if they can come up with maybe just a little bit of a basic plan, like they will go by there alternate times, 3 or 4 extra times a day, just something so we can give them feedback so that the residents feel a little more secure, that they might have a little plan or something if they can.
Yes.
Thank
And
you.
I was actually going to invite police for this meeting, but I'll go ahead and invite them for the December meeting.
Perfect.
Get in touch with them obviously before and let them know.
Thank
Okay. Thank you, Diana. Thank you, Debbie. Okay.
All right, I'm switching him to panelists now.
Okay, everybody mute your phones or mute your whatever. Thank you. And then unmute if you need to speak. Oscar, if somebody has questions, should we type it in the chat? Will you be watching it? Will Dr. Medina or?
He could be watching it, but I'm pretty sure if you want to ask questions, you could raise your hand, and he'll be more than happy to to answer them. He's on right now.
Okay.
Hi, Dr. Medina. How are you?
Good morning. How are you? How is everyone doing? I'm Dr. Clifford Medina. Thank you so much for having me today.
Welcome.
Welcome. So we were interested in discussing, the importance of the influenza shot, especially during the COVID period. So I know that you're really busy, and the group is really anxious to hear what you have to say. So with that, could you take it away, please?
Sure, I'd be happy to. Thank you so much. So I'm the Chief of General Internal Medicine here at Mount Sinai, and I see patients on the inpatient service and the outpatient service. And these truly have been unprecedented times for all of us. So thank you for giving me an opportunity to talk to you a little bit about the flu season and the COVID-19 pandemic. As you know, even without the COVID-19 pandemic, influenza season tends to create a lot of angst amongst the healthcare providers because seasonal flu can be very dangerous for many of our patients. In general, seasonal flu can cause between 40,000 on average 40,000 deaths per year in this country. So seasonal flu is nothing to scoff at. And it can certainly affect many of our elderly citizens, patients who have chronic diseases such as lung disease, asthma, heart disease. So seasonal flu is certainly a very dangerous infection that can be easily transmitted. And certainly from a public health standpoint, it obviously is also very worrisome, especially because seasonal flu can lead to other complications and hospitalizations. Patients sometimes underestimate the flu, especially because, in some patients it may cause mild symptoms, but in others, it's something that can be very dangerous, especially if you live in a home with senior citizens or patients with chronic diseases. So many of the things that we're doing now for COVID-19, we certainly had promoted in the past for seasonal flu. And the thing about seasonal flu is that seasonal flu is a moving target. Seasonal flu is a disease that every year changes, and this has to do with the organism itself, which undergoes shifting in its genetic makeup, which makes it challenging for us as hosts to try and keep it under control. And so what we typically depend on to help limit the impact of disease is vaccines. And obviously many patients have different opinions about vaccinations, but science being what it is, it has shown in the past that vaccines are very important at fighting the spread of the flu across our communities. The flu vaccine has many benefits, including reducing the likelihood of hospitalization. For some patients, it also reduces the likelihood of dying. It reduces the likelihood of developing cardiovascular complications from the flu. And also, it helps prevent the spread of the flu even within your own household or across the community. So it has a tremendous amount of benefits for patients in keeping them healthy and keeping them from having to be hospitalized, or for our younger population, keeping them from missing days of work. And I encourage all of my patients, regardless, to try and get vaccinated with the influenza vaccine, because it can be really, really effective at keeping people healthy and preventing spread of the disease. Now, that being said, the COVID-19 pandemic is a very special circumstances upon which this current flu season is existing. And this could potentially be very problematic for our healthcare systems across the country, because nobody knows how the influenza season will interact with the COVID-19 pandemic. There are different scenarios that people have discussed in the literature. Some scientists, some physicians think that, well, maybe what we're doing now with all the current practices for social distancing and wearing masks and hand washing, maybe these things will be effective in actually reducing the likelihood of us having a very severe influenza season, and that's certainly one possibility. On the other hand, another possibility is that COVID-19 and influenza may somehow interact and make it possibly a worse season, which could be problematic for our hospitals and our doctor's offices, especially if there's a surge within a surge. And certainly that's a scenario that no one wants to see. But really, regardless of whether or not we're in the pandemic, the best thing that we can do to protect ourselves, in addition to a lot of the non-pharmaceutical interventions, would be the vaccination against the flu. And, there's some talk in the literature that maybe somehow getting the influenza vaccine may diminish the effects of COVID-19, and this is all just theory. But it's out there that some physicians think that it may have some protective benefits. But really, the most protective benefit comes in preventing you from becoming sick with influenza. And patients who have influenza, could have less severe symptoms if they've actually gotten the vaccine against influenza. So the benefits are really exponential in terms of how it can impact the community and prevent patients from spreading the disease. And perhaps by vaccinating yourself against the influenza, perhaps you can prevent the COVID-19 from being transmitted. Who knows? It's up in the air. No one really knows. But until we have a COVID-19 specific vaccine, the best things that we can do, again, are doing all the interventions that we've talked about, that we've all been following very closely, and then at this point, vaccinating yourself against influenza. Now, it really is a challenge for us as physicians, because there's not really an easy way to distinguish between someone having the flu and someone having COVID-19. Many of the symptoms are very, very similar, and this presents a big challenge for us. We're going to see patients either in the emergency room or patients who present to us in our practices, and we have to have the tough decision about whether or not someone has COVID-19 or someone has influenza. And really, without doing a test, a nasal swab to actually check for the actual virus itself, it's very hard to make that determination. And certainly it will be a challenge this year trying to make that decision about what's the best way to treat our patients. Influenza tends to strike very quickly, and patients tend to get very sick very fast within the first couple of days. COVID-19 tends to be a little bit more of a lagging type of disease, where usually at the end of the first week, or maybe at the beginning of the second week of the infection is when things tend to turn more severe. But it's very hard to make that distinction just on symptoms alone. And oftentimes it's not very easy to do the testing, and depending on the patient's setting. Thankfully, in the emergency department, we can check the test a little bit more quickly. But in the outpatient setting, it's a lot more challenging since we don't have some of these tests at our disposal. And influenza in and of itself can be problematic because influenza can lead to other infections such as pneumonia, and these infections can be in addition to the influenza, especially for our elderly population who are more susceptible to pneumonia infection. So the over 65 population not only should be vaccinated against influenza, but they should also be vaccinated against pneumococcus. And typically the best way would be to receive the vaccine called Pneumovax or Prevnar. And so the influenza vaccine should be received on an annual basis as early as possible at the beginning of the flu season, as soon as it becomes available, to try and help increase the protection against the seasonal flu. And then patients who are 65 and over or who have lung disease and other diseases should be vaccinated against pneumonia vaccine. And that'll go a long way in helping to prevent patients from having complicated disease and getting very sick and presenting to the hospital and possibly even dying from these diseases. So there's a lot going on right now, and the best thing that we can do is really protect ourselves and encourage our loved ones and our family members to receive the flu vaccine to help protect themselves and to protect their families and to prevent complications and hospitalization. So with that, I'm happy to take any questions if anyone has any particular questions about influenza, COVID-19, or influenza vaccinations.
So, Dr. Medina, recently I've been hearing a lot of people saying that if you do get the flu vaccine, that they're covered. That there's a lessening of the COVID virus to the person, and I think it's the misconception there that you're protected by COVID if you're getting the flu vaccine, that the case of COVID is going to be lessened.
Yeah, so that's theoretical at this point. There's no science behind it. There are no studies showing that. There's really nothing to really say that influenza definitively helps protect you against COVID-19. But there are some physicians out there who think that there may be some benefits, and they may not be explainable at this time. And so the best thing to do at this point is to ensure that you're not going to get influenza, because sometimes these diseases can travel together. There are some reports that came out of China that have documented that some patients were actually getting both influenza and COVID-19 infections simultaneously. We think that the likelihood of that is very low, but certainly having one of those infections is bad enough, but having the other could make things a lot tougher. So anything that you can do to protect yourself against influenza may possibly be beneficial against COVID-19, but definitely would be beneficial against getting a dual infection.
Okay. And lastly, I know that the flu shot, we can get them pretty much anywhere, either at your doctor's office or CVS, Publix, but the pneumonia vaccine, where do you get that? Okay.
Yeah, similarly, you can get them at Walgreens, CVS. You can get them at your doctor's office. Most doctor's offices should carry the vaccines, and they're very low risk. Patients typically will only need Prevnar once in their life after the age of 65, and typically we will follow up a year later with the Pneumovax. We don't give those vaccines simultaneously. Those are usually separated out by 1 year.
Okay. All right. Any questions? Any other questions?
Thank you, Dr. Medina. This is Debbie Quaid. Just a quick question on the most common side effects, so those that are watching here can see that it's not as crazy as some people report. So the common side effects of getting the flu shot?
Common side effects of the flu shot are mild achiness, low-grade fever, fatigue, and those side effects are not that common, but when patients do get them, typically we advise them to rest and take Tylenol for the symptoms, and they usually resolve within 24 to 48 hours. Sometimes there are patients who have egg allergies, and that's often the question that we ask our patients. And that's something that certainly should be discussed with physicians. If they have egg allergies, they should discuss that if they're going to receive the flu shot. You can still get the flu shot, but there may be some other steps that need to be taken beforehand. And a very rare side effect is a neurologic condition called Guillain-Barré, but that is extremely, extremely rare.
Well, I have to say, out of the over 100 people I know that have gotten their flu shots this year, not one has had any issue, no problems. They feel great, didn't hurt, shot was fabulous. So thank you for helping us encourage everyone to get your flu shot this year.
Absolutely. Yes, Gabby?
What happens if you have a coronavirus, no symptoms? What happens if you receive the flu shot?
Well, I don't have a specific answer for that in particular, but I will tell you that we give patients with other infections, we have patients who come in with colds, and we still give them the flu shot. So there's not necessarily a danger for patients if they're a little under the weather to get the flu shot. I think if someone is seriously ill in the hospital with a very bad disease, I would not give them the influenza vaccine because that would not be the appropriate place. But even people with mild colds, we do give the influenza, and it's not specifically a dangerous thing to do that, to give them the influenza vaccine. So I guess we'll have to see how things unfold with COVID-19. I haven't, at this time, I haven't heard of anyone receiving influenza vaccine. We're just starting the influenza season now. The vaccine just came out probably late summer, early fall, so it's only been out for a little while. But, I think that anyone who has a severe infection should not receive any type of vaccine. But if they have a very, very mild cold, certainly it's safe to receive the influenza vaccine.
Okay, thank you.
Great. Thank you, Dr. Medina. Really appreciate it. Diana, is there anything else? Gabby or Debbie?
I don't think so. I'm good.
Okay.
In the normal conference room. I mean, it could be something that Sabrina.
Okay, thank you very much, Dr. Medina. We look forward to seeing you in the near future.
Thank you.
And thank you for supporting our seniors. Have
Thank
a beautiful
you.
day.
It's a pleasure. Bye-bye now.
Thank you.
Thanks.
Sounds good. Well, thank you everyone for your time. Really, really appreciate it.
Lucy has to be in the silent. Oh, now it's yes. Oh, it's okay.
Okay.
I'm sorry about that.
Okay, can everybody hear me? I don't know if I unmuted or not.
Yes, I'm
Okay.
here.
Yeah, we can hear you.
Well, that
Okay.
was great from Dr. Medina. Please encourage everyone to get the flu shots. Just be fantastic. Is there anything else that anyone wants to have a discussion about?
No.
I would like to say one thing.
Yes.
So I got confirmation on the yoga that Melina was talking about. It's at the band show through the Rhythm Foundation, and they did like a test run with a private group, which was what Melina was talking about. And it seemed to go well, and he's trying to put it on the program starting in November.
Oh, awesome. Okay.
And it will be on Mondays. He didn't tell me the time, but he will put it on his website and he'll be promoting it. And I will try to keep a lookout and share it with Diana, but he's trying to put it online, not actually online, but on the actual programming starting in November at the band shell.
Okay,
Good.
I was trying to reach
Good.
out to him as well. Thanks.
Okay.
I have to go, guys. Thank you very
Bye,
much.
Oscar. Thank
Okay.
you.
Bye.
So guys, in summary, Diana's going to look into the date for our next meeting. You all are going to go back and speak to your admins and talk about promoting Oscar's assistance with insurance. We're going to try to get our Zoom classes and training. And on that note, we need a motion to adjourn.
Okay. Thank you.
Maggie, you going to make a motion to adjourn?
Yay, yay.
Do we have a second?
Yes, me.
Okay. Bye, everyone.
Bye.
Bye.
Thank
Have a
you.
great day. Thank you, guys. I'll send out that.
Okay.